Hi everyone, Dr. Lucky and my fellow colleagues. My name is Lara Adeyemi. I am a DMP student at Brandman University. This audio presentation is on my chosen theoretical framework on which my CSP titled Educating Nurse Practitioners About Promoting Medication Compliance in the Recovery of Schizophrenia Patients. My selected theory is Peplau's interpersonal relations theory. But first of all, I will discuss a little bit about what schizophrenia is. Schizophrenia is a disease that had no cure in the past. However, with the introduction of patient-centered upkeep, recovery of schizophrenia patients can be achieved through various efforts, such as individual empowerment, a sense of duty on patients' parts, and support from counseling. Hence, the need to educate nurse practitioners in promoting medication compliance is very important, and this can be done through communication. Schizophrenia is a chronic mental disorder that affects early brain growth, interferes with individuals' ability to make good use of their common sense. For instance, hearing, touch, smell, and sight. It affects about 1.1% of the world's population and about 0.3% of Americans' populace. The onset age for men is 16 years, whereas for women is somewhat higher. There is a gap in cure of schizophrenia disease, and this is due to the intricacy of the condition, and as a result, pose as a challenge to the healthcare specialists to regulate the most effective cure that can be used for these patients. Moving on to Peplau's interpersonal theory now. As said earlier on, schizophrenia is a serious mental illness characterized with obstacles for effective therapeutic relationship and communication, hence affecting efficacy in interventions including adherence to therapy and health population. Pepplau's relations theory can assist on the promotion of compliance to the medication and recovery from schizophrenia. Communication plays a vital role in nursing because it facilitates efficacy in interventions such as prevention, therapy, education, and health promotion. Effectiveness in communication and interpersonal relations required the adoption of appropriate theory and approach. This model selected and discussed in this presentation is again Pepplau's interpersonal relations theory. According to this theory, communication is a complex process in which aspects incorporate aspects such as environment, attitude, and beliefs. Pepplau's theory defines 4 stages in communication and interpersonal relations, including orientation phase, identification phase, exploitation phase, and the resolution phase. The orientation phase involves being acquainted to the nurse-patient relationship, and the nurse tries to work on preconceptions and receive initial information on the patient. The opportunity to ask questions and receive clarifications and information is at this stage. The patient gets the opportunity again to ask questions, receive clarification and information. If anything is in doubt, it is clarified here. The focus in this phase should be the development of early levels of trust. Both begin understanding each other and their roles. The next phase, which is the identification phase, the client and the nurse begin identifying problems to address through relationship. The nurse helps the patient to recognize his or her participation role and responsibilities. The patient becomes an active participant in treatment and therapy. The nurse-patient relationship strengthens through understanding, trust, and acceptance. Despite the cognitive and mood swing challenges, effective communications enhance engagement and collaboration. Cognitive and mood swing challenges are things that schizophrenia patients do experience. Expectation phase. At this phase, the patient develops stronger trust to the nurse and the service offered. Client is committed and focused on full exploitation of nurse-patient relationship. Health problems associated with schizophrenia are solved as nurse-patient relationship focus in achieving the set goals. The nurse applies expertise, skills, and experience in solving the health problems. The patient is assisted to follow medical instructions, provide necessary information in the course of treatment. And the final phase, which is the resolution phase, schizophrenia patient is expected to have acquired self-reliance and the health promotions are addressed and suppressed. Patient and nurse collaborate in assessing the health. The nurse-patient relationship is terminated upon the realization of the goals and objectives of the patient. If there is a good relationship and education and communications is processed well, this will help the schizophrenia patients to live a quality improved life, be able to take care of themselves with less dependence on their caregivers. Conclusion: communication in nursing needs to be as effective as possible in health promotion for a patient suffering from schizophrenia. Peplau theory is fundamentally considered effective in communicating and building patient-nurse relations. This model incorporates orientation, identification, exploitation, and resolution phases. It advocates for trust between the patient and client and collaboration. It's very important that a good relationship depending on trust is developed between the patient and schizophrenia patient, between the nurse, and the schizophrenia patient. This concludes my presentation on Peplau's interpersonal relationship theory to help in promoting medication compliance in the recovery of schizophrenia patients. References are attached. Thank you so much for listening. My name once again is Lara Adeyemi, DMP student at Brandman University. Thank you.